Hey everyone, it's Professor C, and welcome to your overview of human anatomical regions. We'll start with the anterior view first. Again, ones that are pretty familiar to you that are in the common language, such as nasal or, well, that should have been a pen, sorry. Let's fix that. Okay, so nasal or oral. Those are all things that you should already be familiar with, so I'm not going to go over those. I will pay extra attention to ones that you probably have not heard of, and then give you some ways of kind of thinking about it. Okay, so again, when we are referring to the entire head, so the head and all the things attached to it like ears, nose, mouth, all that great stuff, so kind of like Mr. Potato Head, that's what we refer to as the cephalic region, because remember, cephalon is Latin for head. The region of the forehead, that is frontal. So again, that is your frontal bone of your skull, and then you have the frontal lobe of the brain that lies deep to that. Pertaining to the eye, that would be orbital. So, because remember, your eye sits within the orbit of the skull. The mental region, this refers to your chin. Cervical is, remember, in modern anatomy, cervical is the neck, both anterior and posterior. However, remember in classical anatomy that the term nuchal, N-U-C-H-A-L, nuchal, refers to posterior neck. And you will see that again in when we're in the musculoskeletal system. The region of the chest is thoracic. Within the chest region, we have smaller subdivisions. So sternal refers to the sternum or the breastbone. Mammary, again, mammary refers to the breast tissue. So, for example, mammary gland. When we're referring to the musculature of the chest, that is pectoral. Okay, so because you have your pectoralis muscle there. So pectoral refers to chest muscle. Axillary refers to under the arm. Abdominal, abdomen, pretty straightforward. You understand that already. Umbilical refers to the umbilicus, otherwise known as your belly button. The pelvic region, so this is the region between the hips. So each one of your hips is actually called coxal. So each one of your hip bones, that is a coxal bone, so that is the coxal region. So in between the coxal bones is your pelvic region. Inferior to that is the inguinal region. This lies just above the external genitalia. That's the groin. Speaking of the genitalia, so there are two different terms you can use to describe the genitalia. The region, just in general, is pubic, but when we're referring to the external genitalia, that is genital. So making our way along the legs, the region of the thigh, this is femoral, because that is your femur, the longest bone of the body, but also the toughest and densest of all the bones of the body. So that is femoral. Region of your knee, that is patellar, because that is the patella, the kneecap. When we're looking at the shin is referred to as crural. Okay, so your anterior lower leg, otherwise known as your shin, is crural. Lateral lower leg is fibular or peroneal, because that is the peroneus longus muscle. Okay, but also fibular, because that is the fibula. So either one of those can be used. The ankle is tarsal. And I've seen other terms for that too, because your ankle bone is the talus bone. So I've also seen the term talar used to describe the region of the ankle. Your metatarsals, those are your foot bones. And then your toe bones, or the region of your toes, that is what we call digital. Those are digits, just like your fingers are digits. And then your big toe is hallux. Now, we don't see that used very often clinically. However, there is a muscle there. It's the hallucis muscle. That's where that comes from. If we're looking at the arms, your upper arm is brachial, okay, because the Latin for arm is brachii. So brachial for the upper arm. Acromial, this refers to the point of the shoulder. You'll learn in the musculoskeletal system that this is the acromion process. The crook of your arm, that is what we call antecubital. So whenever you see the prefix ante, A-N-T-E, it means in front of or before. Cubital is an old term for the elbow. So it's in front of the point of the elbow. That's what that means. Antebrachial, that is your forearm, so it comes before the arm, so hence the forearm. The carpal region, that's the region of your wrist, so think something like carpal tunnel syndrome, for example. And then when we look at the hand, manus is the noun. Manual is the descriptor. So think like a manual transmission. You have to shift the car yourself. When we look on the hand, so palmar refers to the palm, digital for the fingers. The thumb is pollex. And again, we don't see that used very often clinically. And then metacarpal refers to your hand bones. Taking a look at the posterior aspect of the human body, again, we've already determined that we have the head, that's our cephalic region. We're talking about the ears, that is otic. Okay, so if someone has an ear infection, that is otitis. The back of your head, this is occipital, because that is your occipital bone. So again, just like with the frontal bone, you have the occipital bone. Deep to that is the occipital lobe of the brain. And then the muscle that runs back here is your occipitalis muscle. Again, posterior neck is cervical in modern anatomy. However, in classical anatomy, it is nuchal. You want to remember that for muscle attachment. When we're looking at the back, so dorsal is the descriptor. Dorsum, that should be a U. So dorsum refers to the back, noun. Vertebral refers to your vertebrae, so your backbone. Scapular, so for your shoulder blades, so you have two scapulae. The lumbar region, so this is the region of your lower back. Sacral is the region that is between the glutes. Speaking of glutes, the gluteal region, okay, refers to the posterior. Perineal, this is the region between the anus and the external genitalia. So refer that to the perineal region. When we're looking at some of the other posterior aspects of the body, so here in the back, popliteal, so behind the knee. And then the calf, right here, this is what we refer to as sural. So those are your calf muscles. That's basically it. As long as you, I mean, for the most part, as long as you have an understanding of what each of these different words means, then it should be easy to break it down. So when you see it again in other contexts, it'll help give you clues as to what region of the body you're talking about or where you might find something specifically. So again, when we look at something like, say, transversus abdominis, so you know that transverse means across now, and abdominis referring to abdomen, so you know it's a muscle that crosses the abdomen. So with this knowledge of anatomical regions and these names, you're going to see these again when it comes to the naming of muscles, the naming of bones, and some of the nerves and blood vessels that we find in the body. So this is stuff that will serve you quite well as we go throughout the rest of the course. So that's your overview. And if you found this at all helpful, then show me the love, give me some stars, because I love the attention. See you in class.